Hello, everyone. My name's Christina Stapke. I'm a registered dietitian nutritionist. Thanks so much for joining us at Beyond the Needle, a deep dive into acupuncture and traditional Chinese medicine. So a little bit about me and my practice. I have a virtual nutrition counseling practice that's based in Seattle, but I do have the flexibility to see clients throughout the US. And I practice integrative and functional nutrition, which essentially means we talk about a lot more than just food and exercise when we're trying to get to the bottom of your health problems. So for example, we talk about things like genetic factors, your gut health, toxins, environmental exposures, your nutrient levels, because I've learned over the years that really all of these things can really influence your health in a significant way. My story kind of started when I was in college, and a close family member of mine was actually admitted to a rehab facility for an addiction. And at that time, I ended up meeting a staff nutritionist. And he was telling me about functional medicine and nutrition. I thought, like, wait a minute, what is that about? He was creating anti-inflammatory meal plans for his residents. And I kind of, I was definitely intrigued. And he told me that these meal plans were actually going to be helping these residents reduce inflammation in their body, because that was connected to a lot of substance use disorders. And I thought, wow, that's pretty amazing. If there's those kinds of answers for these patients, are there answers to my health problems? Because at the time, I was struggling with a lot of gut issues, hormonal imbalance, things like thyroid issues, and I wasn't really given any answers. I was put on some medications. I just wasn't feeling that well. And along in my journey, I actually found, in addition with functional medicine doctors, I found an acupuncturist, and she really helped me kind of accelerate the path to feeling a lot better, especially as it related to my hormones. So I'm really excited to talk with Jim Bloomfield today, who is an acupuncturist, and kind of hear what he has to say and how he helps his patients in his practice. So Jim Bloomfield he uses acupuncture, Chinese herbal medicine, and therapeutic body work to treat his patients. He's owned Larchmont Traditional Medicine in Los Angeles for 15 years, and he's also the academic director for the American Institute for Mental Health in traditional Chinese medicine. And he sees patients with all kinds of health issues, and he treats them from a holistic perspective. So, Jim, thanks so much for being here.
Thanks for having me.
Yeah, so tell us a little bit, because I know at first when I saw LAC, I was kind of confused as to what that means. Can you tell us a little bit about that?
So LAC stands for Licensed Acupuncturist. And in certain states like California, it also means herbalists. So licensed acupuncturists and herbalists. So those are the main modalities that we use in terms of just the technique. There are 15,000 board certified acupuncturists in California alone, and as many as 35,000 in the country. But acupuncture itself, it comes from a large field of medicine called Chinese medicine or traditional Chinese medicine. And LACs they're complementary and alternative providers, which means that we have training in the basics of biomedicine or Western medicine, but we also use other methods to provide care when the conventional medical system may have little to offer. So we'll typically use acupuncture, we use herbs, nutritional supplements, body work, lifestyle counseling, and diet therapy to treat and sort of treat disease and also to recover people's state of wellness.
Awesome. Yeah, thanks so much for that explanation. So sounds like, yeah, it is a lot more than just being an acupuncture, or just, putting needles in people's bodies, which I'm super excited for you to dwell on, because I think that's something that people think of when they think acupuncture is just, getting poked. So I'm excited to kind of learn more. So tell us a little bit more about your practice and kind of what got you into this field.
So my story starts when I'm a teenager. Actually, as a child, I was always interested in medicine. I always liked thinking about the body and the way the body worked. And when I got sick, I would go to the doctor and, he treated me, and sometimes I got better and sometimes I didn't. And, I had allergies and some other issues. But I managed to just sort of get to 18 or 19 or whatever, and I was relatively healthy. I went to college. I was traveling on a semester of travel that I was doing as part of a program, and I got really sick, and I had a lot of different issues going on. And I got back to the University of Colorado, and I started going to the clinic there. And they didn't really have much for me. They would say, oh, well, we're going to check your blood, and we're going to look at all these symptoms, and we take some antibiotics. This should help you. And I would take them, and maybe my symptoms would get a little bit better, but for the most part, I wasn't feeling any better. And then as soon as I got off the antibiotics, everything would flare up again. So what they ended up deciding was, well, we don't really know. It looks like there's something going on with your immune system. You might have leukemia. We don't really know. And I was like, I'm not ready to just go down this road. So I looked up acupuncture in the phone book. I had heard about it, and I knew that it was useful for the immune system. So because they said there was something going on with my immune system, I thought, well, I'll check it out. So I ended up meeting a practitioner, and the first time I saw her, she did a bunch of stuff. But one of the things that I laugh about is she said to me, I know what's wrong with you. You have an antibiotic deficiency, so we're going to give you antibiotic. She was just kind of joking. But what she did was she did acupuncture and homeopathy and some other sort of some chiropractic manipulation. And she just kind of exposed me to all these different alternative types of treatments. But really, I felt better immediately, and I'd been sick for months, and I was at the point where I couldn't really function. I was going to flunk out of school because I couldn't stay awake more than 8 hours a day, and my energy was terrible, and I had inflammation all over my body, and I was in pain, and it was just really hard. I'm 21 years old with this. So within about 2 months, maybe I saw her 8 times, and at that point, I'm 80% better. My energy's back. I'm able to everything's working better. And so over the next couple of years, I just sort of used her periodically. And she introduced me to someone who was a licensed acupuncturist, because she was actually a naturopathic physician, and who was also practicing acupuncture. But she didn't really do Chinese medicine per se, which is, I think we'll talk a little bit more about the differences, what acupuncture is relative to Chinese medicine. But when I decided I was going to move, I was in Colorado at the time. When I decided I was going to move to Los Angeles, she said, well, I've been working with you with Chinese medicine for the last several years. And, I think you should be an acupuncturist. I think you'd love it. There's a great school in Santa Monica. You should go check it out. So I was out here for a few years, and I checked it out. And she said, oh, and by the way, if you go there, you'll meet your wife. So, I was like, okay, sure, sounds good. So I went and I checked out a bunch of schools, and I met different people, and I decided I was going to try to go to acupuncture school. And I took a couple classes, and I just fell in love with it. It was amazing. All the sort of philosophy and the different way of looking at things, and the approach to sort of holistic medicine and using nature to sort of get ourselves, even in a modern time, back into our physical bodies being in touch with the environment to create health. It was just seemed like a great solution to so many problems. And I've always been someone who wanted to help others solve their problems. So I just ate it up from the beginning, and here we are. I did meet my wife there. We're in practice together. And it's now it's almost 20 years since we've been doing that. And it's the only medicine I've used actually for the last 30 years. So since that time that I was telling you about, when I was in Colorado, I have not had needed any other medicine. And so it's worked for me, and it's worked for hundreds and hundreds of people who I've seen since I've been licensed.
Wow. Yeah, I love your story. I mean, from, feeling really horrible, I can definitely identify with that and relate to that, and not really getting answers and kind of, going on these roller coasters to eventually finding something that really worked for you. And finding something that you're passionate about is really awesome. Thanks for sharing. So I'm kind of curious, I know you brought it up a little bit, but kind of how Chinese medicine is different from conventional medicine, and how it differs from acupuncture even.
So acupuncture is a tool which is inside of the whole field of Chinese medicine. Chinese medicine is ancient medicine from China. It's a viewpoint. It's a way of understanding what happens that cause people to be sick, and what happens when people have normal function, normal sort of the ideal physiology, and how that gets interfered with in a way that creates disease, and then how we can kind of reverse that. And so it's very holistic. It's not really, Western medicine is very symptom focused. If you have a stomach ache, they look at your stomach, and, they may look for other causes, but most of the time they're going to start with, okay, maybe you have acid reflux, or maybe you have IBS, or maybe you have, they'll give you a diagnosis, and they'll just kind of like look at the single organ, or look at the single symptom. And if they treat the symptom and you get better, then it's almost like the disease is not there anymore. But often what happens is sometimes the medicines can sort of just mask what's going on, and they can create a little bit further of what we would call dysfunction in the body. So because they interfere. So one way that we talk about acupuncture is we say, or Chinese medicine, is we say it's holistic. In other words, it works with the whole body together. And actually beyond that too, which I hope to talk about a little bit later, rather than just being symptom focused. But the other thing is that I like to say it's like pro-medicine, meaning it's medicine that is trying to reinforce something and push something in terms of function. So it's like functional medicine, because what you're doing is you're working with a function that the body already has, and you're enhancing those different functions in order to rebalance the system and recover the overall function of the body. So in terms of, if you look at sort of the way that drugs work, they're typically more like they tend to interfere with something that's going on in the body. So we have antibiotics, right? Their purpose is to go and kill bacteria in the body, sometimes including the bacteria that we need to help us digest our food, and get energy from our food. And also those bacteria help with our hormones and all kinds of things. But or antidepressants, they interfere with the body's reuptake of serotonin if it's an SSRI, or anti-anxiety drugs, which interfere with this other communication in the brain, or anti-inflammatories, which interfere with the inflammatory process. So these drugs are designed to kind of break a chain of chemistry that causes something to happen in your body. In Chinese medicine, we want to kind of leave that alone. We want to sort of let the body work as it sort of we're made to, and we want to use our own abilities to change those dynamics to rebalance. So it's more general, it's less specialized, and also it's a kind of a journey, because when you're doing natural medicine, usually what's going to happen is your practitioner is sort of more of a partner. We call you a patient, but we're really working with you, and we use your entire presentation, whether that be physical, mental, your health history, what type of problems you've had, and even sometimes your family's health. This is our kind of what we use as guidance to direct us in your treatment. And then over time, we sort of evaluate, and we see, and we adjust, and we change, and we really try to sort of move through to a new place, and even from there we can move on. So that's a little bit more kind of about the differences and also how we practice.
Yeah, I love the pro medicine versus anti medicine. I think, I've never thought of it that way, and that does seem to be kind of what conventional medicine is kind of blocking function sometimes. I mean, obviously trying to help us regain function, but by blocking other means. Mm-hmm. So it sounds like, Chinese medicine is more of allowing the body to kind of do its own thing and ramping it up to allow it to do those things better. So I'm curious because I see a lot of people with gut issues in particular. So, for example, something like irritable bowel syndrome is so common. Can you tell us about kind of how you would treat someone or how you would approach a case with someone with something like IBS?
Yeah, so with irritable bowel syndrome, we often are dealing with a syndrome, which means that it's a lot of different symptoms altogether. Doctors will use different types of, they'll use different kinds of drugs. They'll use antispasmodics. Sometimes they'll try to treat with fiber, even sometimes with, just changing the diet, which can be very helpful. And they may use antidepressants to work with the nervous system. So they are kind of looking at IBS as a syndrome. Once a solution is found, if they are able to sort of get the person feeling better with that, then that's good. The person's taking the medicine, they're feeling better, so their job is done. For us, what I would do is I start looking at the whole person's system. So in some ways, when a person has problems with their digestive system, I'm definitely going to start with the nervous system. I'm going to try to figure out, because we know that when people have stress, their IBS gets worse. We also know some people have pain. Some people they just constantly have diarrhea. Some people have constipation. All these things are different dynamics that are happening, and they happen at different times for different reasons. So we want to try to understand all of that. We may include some diagnosis about the way that, because in Chinese medicine, the energy of the lungs helps to descend all the energy in the body. So if a person has constipation and the lung qi, we say qi, which just kind of means function, is weak, then we need to work on that in order to be able to get the digestive system to work better. Also, the liver can be involved. If the person is really stressed and tense and has tight shoulders and maybe has, a lot of diarrhea, then the liver function, we're going to try to look at that. And we could see that if the liver is not functioning well, then the person's going to be more toxic as well. And toxins can also affect IBS when they accumulate in the system. So we can treat it, there are foods that aggravate the person, and we can eliminate those foods, and often that's helpful. But their system still needs to be strengthened and nourished and recovered. And really that's what we focus on, so that when they're done with treatment, they're better. Like, they don't need to continue to take anything except to eat well and try to control their lifestyle and avoid the things that make them worse. So, and that's enough at that point.
Yeah. So, I mean, what you said earlier about, taking away the foods to kind of help improve their symptoms is okay for that time, but is not optimal in the long term. And that's what I tell my patients and potential clients so many times is, we can't just be on a long-term restrictive diet, and that's not the end of the story, right? There's reasons why you can't tolerate those foods. So finding a practitioner that kind of can uncover why you can't tolerate those foods is super important. So that's awesome that you do that in your practice.
Well, because the immune system also is so affected by everything we eat. So much of the immune system is around the digestive system. Literally, physically, the immune system is focused around the digestive system, also around the respiratory system, the lungs, the skin. So, we see people who have digestive problems, skin problems, and allergies or asthma at the same time. This is very common in children too. But we see adults with this kind of thing, and they're on many different meds. They've been taking steroids since they're a little kid for their whatever they're on. They can be on very strong medications if they have, say, like psoriasis. People are on like chemotherapeutics for psoriasis, which may alleviate their symptoms and really give them necessary relief, but may not be needed if we can actually figure out how to do it differently. And often we can. So I think that's the thing people don't realize about natural medicine, is that even though it's very gentle, it can be super effective. And actually sometimes the sort of extreme measures that we might take because that's what's available are not really necessary, and they're not the best way to deal with it.
Mm-hmm. Yeah, I totally agree. It's a great segue into my next question for you. What do you feel like are the biggest misconceptions about acupuncture or traditional Chinese medicine?
Well, I think people might not know about acupuncture without experiencing what it actually feels like. Some people have asked me, so when you put a needle, are you like poking at my stomach, or are you poking at my bone, or poking at my muscle? And actually, we're not doing surgery with acupuncture needles. It doesn't work that way. What we're actually doing is we're trying to stimulate the skin, which creates a system of like ripple effects between the local immune system, the local nervous system, and it can affect, the rest of the nervous system. But Chinese medicine, acupuncture, is a relatively sophisticated system where you have to use the right points in the right combination for the right person at the right time. And the way that we get there and to understanding is through a pretty sophisticated diagnostic understanding. For me, I use a lot of palpation for diagnostics. So I like to take the pulse. I like to poke around the body at different places to see, does this hurt? Does this hurt? Does this hurt? And I may check something on your foot to see what's going on with your stomach. And I may treat that point by treating something. I may treat by putting a needle in your forehead. So it really, there's infinite number of possibilities and combinations, but we really try to find the best way. And often the person will notice while they're on the table, they'll notice a difference in how they feel, not just sort of in their symptomology, but they'll feel very relaxed, and they'll feel more like pleasant sensations in their body. And they'll start to, we are affecting sort of the endorphin system as well. So, but that's not the only thing we're doing. It's kind of a reset for all the different body systems, and it helps to just recover the function so that you can do what your body's meant to do, which is to heal. So we don't really fix people with needles. Like, what we do is we stimulate the body, and then that promotes a healing response, which that's yours. You own it. You did it. Like, people say, oh, you helped me. I'm like, yeah, that's what I did. I just helped. But your body just did what it knows how to do, which is to heal. And all we did was kind of set it up so that to give it sort of a little bit of a push in the right direction, and then you take over and you do it yourself. Some people think, oh, I'm just getting relaxed and that's why I feel better. And that may be possibly true, but it really does make profound changes in the functioning of the body system.
Yeah, it's amazing. I love, your the thing that you say to your patients, and your body's really healing itself, because that's ultimately what natural medicine and integrative and functional medicine is doing, is just allowing your body to do the work. Once it has the tools it needs, and you take away the things that are kind of keeping it from doing its job. So I know people kind of can think of an acupuncturist, and if they have a back issue or some kind of acute pain. So what are the biggest mistakes people make when they're trying to understand the causes of this kind of pain?
So people can come in with back pain. They can say, well, some people have an acute injury, so that's that's common. And it's pretty easy to say, okay, well, you have a muscle spasm, and we can try to help you heal that. Sometimes there are blocks to healing that, so we have to figure out what those are. But a lot of times people don't know what causes their back pain. They just go, oh, I slept on it wrong. So I always tell people, if your bed is the problem, that's not your problem. Like, we should be able to sleep without hurting our back. So, and your body, you should, ideally, our bodies would adjust our position and know sort of intuitively what position we need to be in for sleep. But if if our nervous system isn't working well, or we're, in a state of trauma or stress emotionally, that can affect our body's ability to work with that. Also, we have our own natural anti-inflammatory system, which is actually, in Chinese medicine, we say is related to the adrenal glands. And in Western medicine, they would say, well, that's related to a hormone called cortisol. And that helps our body not react all the time with inflammation when there's this little injury. So people who get an injury and can't heal, sometimes we just have to work on that part of their system. So we're not usually just going to be putting needles like where the injury is. Another thing that can cause back pain for people is if their digestive system is not working well and they're having sort of back cramps. Women with menstrual problems often have back pain, so we have to treat the spasm of those sort of smooth muscles of the uterus, and also the hormonal balance, which causes those spasms to happen. People can have back pain from having a cold or a flu. And so if that's why their back hurts, we're going to treat that. So, I think if people have back pain, it's not always from your back. And so you want someone who's going to look at it and go, what can I do besides just give you pain medicine?
Yeah, absolutely. So it's a lot more than potentially just an injury or sleeping on it wrong or something that seems more obvious. So can you tell me about kind of what your process might be like? Let's say, you have a guy coming in, he said he slept on his back wrong. He has some back pain. He needs some help from you with acupuncture. What kind of treatment would you do for him?
So the first thing I'm going to do is get a health history. I'm going to find out what this person's lifestyle is like, what they do for a living. I'm going to ask them about a lot of different things around their digestion, sometimes personal things around their relationship. I might ask, it just depends on kind of where I seem to feel that I need to start. But then after that, I'm going to do an exam. So I'm going to check the pulse, and we have a pretty sophisticated pulse system where there are 9 pulses on each wrist. There's actually more than that, but I typically just use the 9 system. And we can almost like sense what's going on in the different organ systems through feeling the pulses. It's not just like the rate and the rhythm, it's also the quality of the pulse. So someone who's really nervous and tense, their pulse is going to have what we call like a tight or wiry quality to it. And normally when that's happening, we know that we need to work on that to resolve their health problem. But also I might start poking around, and I may check, I'm going to definitely check on the whole spine up and down. I'm going to check the muscles of the back. I'm going to check the abdomen. I'm probably going to poke around the umbilicus, the belly button a little bit. I'm going to feel the feet. I'm going to look for sensitive spots that are kind of reflections of other problems in the body. And then I come up with a diagnosis, and I say, this is what I think is going on. This system is interacting with that system in this way, and that we just need to adjust this part. And then I have a way to do that. We do some needles. I see I check those, go back and check to see if we've changed anything. Is the pulse different? Are those points that were painful? Are they still painful? How's your symptom? That's pretty much how we proceed.
Got it. So yeah, really, really comprehensive look. It sounds like it's not just the area that they're feeling their pain and then stick some needles in and then you're good. Right. It's a lot more comprehensive. Yeah, that's awesome. So what do you feel like is missing from people's care when it comes to promoting health and preventing disease? Common things like diabetes, heart disease, and so forth.
Well, Diabetes and heart disease are advanced disease. I mean, these are conditions which, for some people, we can help them, but we probably aren't going to be able to reverse that completely. Those problems were caused through a long process, and some of that might be from gestation and birth. Some of it can be from their childhood experiences, their foods, their nutrition in general. Certain nutrition or deficiencies in nutrition can cause food cravings. Those food cravings lead to a diet that may not necessarily be a balanced diet, which can cause more imbalance in the body. And so I think one thing that's really significant is a lot of people don't see their habits throughout their life as affecting their present state. Like, I just got afflicted with this problem, but people don't say, well, what happened to me that caused me to have this kind of symptom, or how did this develop? What did I do, or what did I take, or how long have I not been sleeping and living on coffee and not eating, and how am I seeing my body as something that isn't really like a living system that needs certain things to be well. So it's like, oh, I read that I'm supposed to eat this and exercise this much, but maybe that particular prescription is not exactly what you need for your particular problem. I think we all are connected to our environments in a way that's really deep. I mean, we grew out of the earth, right? So it's important for us to kind of understand how our systems are so sensitive and reactive. That's what we do. People, we don't necessarily think about where we came from that way. But we're sensitive and amazing beings, and we have powers to perceive, but our modern lifestyle kind of diverts our attention from ourselves as like living organisms that constantly react and adapt to our environment, which is, I mean, it's so obvious that that's what we do, but it's easy for us to be sort of distracted from that. We tend to take our bodies and our lives for granted. So we don't really think, wow, I'm alive. Like, I feel in touch with this life that I have inside of me. And so I think that leads to a lot of disease in a lot of ways, both the lack of sort of attention to that, and also when we don't have the benefits of health, it's very difficult for us to have the types of experiences on a day-to-day basis that reaffirm ourselves as living people. And I think when we start to think about what it means to have that experience, we realize how connected we are to everything around us, and that we're part of our environment, and that there's a cause for everything. So if there's a cause, then there's a way to sort of then there should be a way to correct that. And I think the cause is a lot of times we're fighting against what I would call our undeniable connection to the environment, and that we're not able to connect our habits with our illness, as I said, and that our attitudes and our actions it's based in what I like to call the illusion of separateness, which is that we are not necessarily tied to our environment, to our own behaviors, to our own history, to our family's history, to our culture. All these things affect our physical bodies, and I think we need to understand that in context. So, like, if we look at how we've sort of polluted the environment and all that's started now to come back and affect our bodies, I really believe that a lot of what we're dealing with in the modern health problems have to do with toxicity. So everyone wants to detox, right? Which can help, but in general, we can detox, but if we continue to toxify while we're detoxing, or if we don't give our bodies recover the abilities for our bodies to detoxify themselves, then we're not really doing ourselves any real good. And so and I think a lot of people have damaged themselves because they've neglected that understanding. And before we had so much technology, nature taught us how to take care of ourselves. We had to be in sync with the cycles of day and night, the seasons, the changes in availability of food. And these circumstances forced us into behavior that allowed us to stay well and to survive. And now people are sick, like in so many ways, and that makes ripple effects to everything else. So this is where we kind of get into holistic medicine from my viewpoint, which is that, it affects our lives from day to day. It affects our experience, our attitudes, our moods, our energy levels, our ability to live the lives that we want to live. And that has broader effects, like in the society and in our families. And we need to focus on health throughout the whole system, our body system, our family system, our social system, and the ecological world that we live in. So how and what we eat, when we work, when we rest, these things are all influenced by the modern environment, which is something that's outside of us that we created, rather than by the natural world that created us. And so we've forgotten that we're made by nature, that the natural cycles of the day and the night, the year, and a lifespan are what define our humanity. So I think when we get in touch with that, we can live more in sync with the natural cycles. People will be healthier and more fulfilled. And because our mental experience is so connected to our physical one, I also believe that being healthier in the physical sense would solve some of the bigger problems we experience with mental health in our families and in our society as well. So that's, this is my soapbox on holistic medicine and really why I feel it's so important. And, I really want everyone to take care of themselves, because I think it's, and learn how to understand their own ability to heal, because I think it's really the outward effects of that are infinite, like what we can do with that. So I really believe in it, and I hope that people will start to think about this more with all the problems that we're having, and that we can start at home and then sort of branch out from there.
Yeah, there's so much good stuff in that. Oh, sorry, we're getting a little echo. So first of all, disease doesn't just happen. That's a huge piece that I take away from what you just said. I mean, it's habits over time. It's things that you do every single day. So yeah, I mean, just think about that. You don't just get diagnosed with a disease and it, just started today. So thinking about the little habits is so important. And then also the fact that, you talked about health basically coming full circle, and our health being connected to nature and the environment is not far off at all, because we're actually seeing how it affects our health with, like you said, with the pollution and really high levels of toxicity. Jim, I remember you telling me that I think we digest a credit card's worth of plastic in a week. You were telling me.
I saw something along those lines in a report. Yeah.
Yeah, it's crazy. So just acknowledging that, the way that we treat the environment can directly come back to us and our health. So thank you so much for sharing about kind of how you run your practice and how you treat your patients, and kind of your viewpoints on holistic medicine and Chinese medicine, natural medicine. Tell our audience how they can find you.
So you can find me on Facebook. It's probably the easiest way. Larchmont Traditional Medicine, 3 words. If you type that into Facebook, you can find our page. And if you get there, you can message me or say hello. And you could also find me, ltmla.com. So that's Larchmont Traditional Medicine, LosAngeles.com. That's our website. And it has a little bit of information on it about just sort of what we do and where we are and all that. So, and contact information as well.
Great. So I just put that in the chat for anyone that wanted to get in touch with Jim in the LA area. Jim, thank you so much for your time. And I hope everyone that got to see this or is listening, thanks so much for tuning in. Hope you could take away something valuable. Thanks so much. Take care.
Thanks, Christina. I really appreciate it.
Yeah, you're welcome. Bye.
Bye.